How much is too much protein intake? The first advice is stop eating everything. Don't take any type of food. That is a wrong concept. Because, greetings. I am Dr. Sandip Prabhakar Bhurke. I am a consultant nephrologist in Mumbai. I am a kidney transplant physician. Today I am going to talk about safe protein intake in kidney patients. Safe protein intake for kidney health. Whenever we are talking about protein intake, it is related to the kidneys because the protein gets digested in the body, it gets metabolized into amino acids, and then it builds the muscles of the body. Whenever we are having the amino acids flowing around in the blood, they are filtered through the glomeruli and they are reabsorbed back from the urine as they are useful products for the body. So in chronic kidney disease patients, these amino acids which are going through the glomeruli cause pressure on the glomeruli, and this can worsen the fall of the decline of the GFR. In chronic kidney disease patients, we advise them to reduce the protein intake, but we do not advise them to stop any type of proteins. The normal protein intake for a healthy person is 1 gram per kilogram per day, and 50% of that is the high quality, high biological value proteins. In vegetarian persons, it is paneer, which is the Indian cottage cheese, soya bean, and mushroom. While in non-vegetarian persons, we advise egg white as the best protein, which has a biological value of 1, followed by fish, meat, chicken, eggs, and mutton. Whenever we are having a chronic kidney disease patient, we tell them to take a protein intake of around 0.8 gram per kilogram per day. The patients who are affording having a financial system with them, then we can tell them to take a low protein diet, very low protein diet, along with alpha keto analogs and protein supplementation produce powders. And this helps us to have a very low protein intake and less pressure on the glomeruli. These patients have a monotonous diet and sometimes they give up on these diets and switch back to the routine renal diet, which is 0.8 gram per kilogram per day. But in chronic kidney disease patients who are having infections, sepsis, some surgery has happened, and wound healing is required, in such patients, we give them a actually high protein diet. This can go up to 1 gram per kilogram per day, 1.2 gram per kilogram per day, or even 1.4 gram per kilogram per day. This is achieved with the help of protein supplements, which can be orally or it can be IV, that is the total parenteral nutrition also. Myths about kidney and protein intake. Diet, when it is taken by the chronic kidney disease patient, there are lots of advice. The first advice is stop eating everything. Don't take any type of protein. That is a wrong concept because the protein is required for the general health of the person and muscle mass of the person. If you stop all the protein completely, the person will become malnourished and he will become more ill all the time. And this illness will actually increase the creatinine later on. If you lose the muscle mass, the creatinine value in the blood falls, not because the kidney is better, but the muscle mass is less, which is a bad thing. The second myth which is there is that if you have a kidney stone, drink lots of water. The kidney stone are stones, they do not dissolve so easily. In fact, if the kidney stone is in the parenchyma of the kidney, it can keep on increasing in size without causing any pain to the patient. Also, if there is a stone which is stuck in the ureter, the pipe of the kidney, then drinking enough water, that water may go out through the other kidney while the kidney stone stuck there can have urine which is stuck upstairs and cause thinning of the kidney upstairs, and that leads to a chronic kidney disease of that kidney, damage to that kidney. So it is very important for kidney stone patients to have a sonography once a year for lifelong so that we come to know whether new stones are being formed, what is the change in the size of the stones, are they increasing in size, or are they causing more damage to the pipe of the kidney or the kidney itself. One more myth about kidney is that if you have kidney disease, stop all protein intake and you have to starve yourself. That is a wrong concept. In fact, in a kidney patient, if you starve, you don't take liquids, you don't take water, then the kidney becomes dehydrated and your creatinine actually rises. So, in Jain people who take very strict waterless fasting, and in Muslims who do roza, it is advisable for chronic kidney disease patients to not do any type of religious fasting and to maintain an adequate water intake to help save the kidney. The rise in creatinine in kidneys of such patients is usually an acute kidney injury which may be reversible or may not be reversible or only partially reversible after reinstitution of water intake, either orally or intravenously for these patients. The signs of excessive protein intake in any person, like bodybuilders, who take around 16 eggs per day, a very high caloric intake, a very high protein intake, supplements of whey protein, supplements of creatinine, maybe nothing. You may just have a rise in the creatinine in the blood reports. You may have a slightly high phosphorus, slightly high potassium, and sulfurated products in the blood increase, and that can cause a slight nausea, less food intake. But body wise, the person may not have any problems. After the creatinine rises appreciably, then you may have the signs of kidney issue itself, like swelling of the feet, less urine output, higher blood pressure, and later on you will have the signs of kidney failure like pulmonary edema, pericardial rub, etc., but that is in an advanced stage. But initially very high protein intake, which is still affecting the kidney to a minor level, may not have any signs and symptoms at all. Safe protein intake for kidney health. This question is asked frequently to a nephrologist by even the normal person. Whenever the person is normal, a balanced diet with adequate intake of all types of nutrition like carbohydrates, proteins, lipids is enough. A routine water intake of around 2 liters per day for an adult is enough. You do not need to think about kidney health. You're not a diabetic, you're not a hypertensive, you're a healthy person, then a healthy balanced diet is good enough. But then in a chronic kidney disease patient, it is very important to balance the diet as per the reports. Once the routine reports of creatinine, calcium, phosphorus, uric acid, potassium are available, the new nephrologist will be the one who will prescribe a diet in which the amount of protein to be eaten, the amount of calcium, phosphorus, salt, sodium, chloride, and even other uric acid balanced diet is advised. Then the patient is referred to a renal dietitian nutritionist who will prescribe the diet in a variety of ways so that it is not a monotonous diet, and daily timetable will be given at different times, different types of food will be given. The dietitian will call for the size of the chapati, roti, flatbread which the patient is having, the size of the bowl, vati which the patient is having, and accordingly adjust the diet plan. And rather than telling the patient what not to eat, the dietitian will tell the patient what to eat, which is more important. And then the protein intake is balanced with a high biological value, whether vegetarian or non-vegetarian, and this leads to safety of the diet for kidney patients.